Hi guys, it's Sarah. Okay, so for our second discussion talking about the pediatric urinary tract, the first question, what anatomical differences are there between an adult urinary tract and a child's urinary tract? And honestly, when I was reading the article, I didn't really notice any differences between the two. It talks about how early on the urinary tract is actually developed in a fetus, so like the first 4 to 8 weeks, and about if they do not develop correctly, how many like abnormalities there can be, which I did not know. I didn't know that it was like such a big deal to have something wrong with your kidneys that can develop like defects throughout the whole entire body. I might have missed something, so just let me know if I did, if there's any differences. The second question, discuss at least 2 pathologies common within the urinary system of pediatric patients. So the 2 that I'm going to talk about are UTIs and then the duplication of the ureters, so the vesicoureteral reflux. Probably saying that wrong, but so UTIs, super common in children. I actually kind of have a personal story about these 2, that's why I'm talking about them. But when I was a baby, so I was under a year old, I kept getting recurrent UTIs, and the doctor didn't really know why. They would just treat it with antibiotics and move on. And when my sister was born, she was actually born and she had a cyst on her kidney, so it was a benign cyst. But they wound up finding out that she had the ureters. So then they wound up looking at me, finding out that I had the exact same thing. So we had the complete duplication. So one side of our kidneys had 2 ureters going all the way from the kidney to the bladder. They decided to go in and remove the extra 2. I know in the article it talks a lot about like how by the age of 10 a lot of the children grow out of it, but for some reason they decided to just go in and remove both of them. Well, me and my sisters. And they found out that the reason why I was getting the UTIs is because of the reflux. So the urine was traveling back from the bladder back into the kidneys and giving me the UTIs and kidney infections. So I've known about that for a long time, but I've never honestly really looked it up or read an article about it. So that was kind of cool to look at and figure out that it was like it's the #1 most common congenital anomaly. Also, we wound up finding out that my older sister, when she was born, had the same exact thing. I don't know if she had the surgery or not. I never asked her, but yeah, so from my parents. Third question, how can parents like help in the room and stuff like that? And I would basically say that it would be really important for the parents to be in the room, especially with younger children if possible. I think that having the parent be able to explain the procedure to the child before it actually happens would make a huge difference. Kind of just make them feel more comfortable about it and not so scared like it was a medical procedure, but more like, you know, just like more fun, I guess. So having the parent like be visible to the child so they feel less scared, I think that would definitely help. And just make sure that the parents are obviously wearing the proper lead. They're standing kind of far back from the fluoro machine, just in case. And then I think that maybe a parent should not be in the room depending on, again, the age of the patient. If the patient's older, you know, like maybe like a teenager or something like that, and they ask for their parent not to be in the room, I would try and grant them their wishes. I think that, you know, I just want my patient to be as comfortable as possible. So if they don't feel comfortable, especially with the voiding or anything like that, I would ask the parent, like, you know, is this okay if we do it and you're just standing outside the room in case we need you? I would not let a parent inside the room if they were pregnant. And, you know, just like if for any reason my patient kind of made it seem like they didn't want their parent in the room, I would try and keep them out. Sorry, I keep looking over here. I'm just reading what questions there are. And let's see. What experience have you gained so far, either in the program or personally, that would assist you in caring for pediatric patients? I guess the biggest one would be just to talk to the child at their level. So don't use a whole bunch of medical terms that they're not going to understand, that are going to scare them. Make sure you use words that they're like relating to. We like to say like urinate and urinary tract and all that kind of stuff, and they have no idea what that is. So I feel like using those kind of words would just scare them, and like they wouldn't want to have the exam done. So talk about, like, I don't know, use words like pee-pee or potty or something that the child's going to actually understand. I also think that a big one would be, I tend to look at the fluoro monitor a lot, and a lot of people don't pay attention to the expressions on their face. So just making sure that you have like a neutral expression, not to scare them if you see anything on there, not to say anything out loud like there's a cyst or there's something wrong to scare your patient. You know, you just kind of want to keep it like pretty calm. And yeah, hopefully I didn't miss anything. But just let me know if I did. Okay, bye guys.